I'm Mark Zaccaria. This is Common Sense, the program that tries to make sense out of the issues that affect your life and come up with common sense solutions. Welcome back. I'm here today with PatRimoshytus. He's a marijuana professional here in Rhode Island, and he is one of a growing number of professionals who are giving medicinal cannabis a good name. So, Pat, welcome to the program. Tell us a little bit about Green Cross, which is your operation.
Sure. Green Cross of Rhode Island is basically a membership organization that allows caregivers and patients. Caregivers in this state are considered growers, to come together and to learn, to share information, and also to provide access to safe and reliable medicinal cannabis here in this state.
Great. And so are you then actually a grower, or are you more of a broker?
I'm a grower myself. I'm a patient and a caregiver in this state. Each caregiver is allowed to grow for up to 5 patients. So we try to make sure that any caregivers in our organization have a full load of patients. We ask them to maximize their card to 5 so that any overage they might have would be able to be utilized by other patients within the organization.
So the answer is yes to all of those questions.
All of those questions, yes.
When you actually have a marijuana plant as the source of any of the products that you use, approximately how many different variations or products come from that plant? How many different things do you get from one plant?
Well, there's many different types of material that can be used from the cannabis plant. Basically, the primary ones are flower, which most people know of as the smoking material. But a lot of our patients, our older patients, prefer edibles, which are usually made with a butter or an alcohol-based tincture, which is easy for them to swallow, put a few drops on their tongue. So there's a lot of different ways out there that they can consume this product, and for us, we specialize in those and one other particular medicinal oil that's it's called Rick Simpson oil, RSO. It's made with an alcohol-based product through cold-filtered roto-vape, so it's very modern and laboratory distilled so that patients can get the most benefit that they can. There are other things on the market that we don't particularly use, wax or oil, sometimes referred to as dabs. There's a space for them in the market. We just don't promote that at our space.
And that's primarily because the patients that you yourself treat don't need them, or it's not the best choice for them, or is it because it's too complex for you to produce it locally in small batches?
It is very complex for us to produce it. The state has mandated certain processes of making it illegal, so we try to stay away from that for one purpose. There is a point for it in the market where, as far as you're trying to come off of opiates or for severe pain relief, but at the same time, we feel that it is, you can get the same relief from RSO that you can from those products, and RSO is not as easily abused. So it can't be used as recreational as these other products can.
So despite the fact that this RS oil comes from the marijuana plant, it's not necessarily directly associated with the euphoria or the high that people associate it with it.
Right. So we can actually manipulate the product down to the milligram now through the testing process. So we have the ability to make the milligrams of THC versus CBD, which are the 2 main compounds in the plant. One, THC is the euphoric part, and the CBD is the more medicinal grade. So we can match those levels higher or lower either way, in either direction.
Okay, so you can adjust it to be mostly medicinal
for the patient.
And it sounds like you can also adjust the dosage per unit.
Sure, absolutely. We have some patients that are as low as 2 or 3 milligrams of THC and 8 or 10 milligrams of CBD. And then we have patients that are on the far end. As far as like cancer patients, for instance, they need 750 to 900 milligrams of THC a day, and that's quite a bit.
And then that's primarily for pain relief.
That's primarily for pain relief, but if someone had told me a few years ago that cannabis had a chance to treat cancer, I probably would have laughed in their face. But I've seen it with my own eyes, and it does have a chance to inhibit cancer growth and sometimes even reverse it.
So where it's been used initially as some sort of a an analgesic for pain relief,
Sure.
you're finding that there are additional benefits for it in this particular case with cancer.
Yeah, there are many different uses for it right now. Basically, here on the East Coast, we're about 20 years behind the market on the West Coast. There's many different uses. I've seen people treated with Alzheimer's all the way down to youth patients. Some of the patients that have it that are autistic, I've seen autistic patients treated with it and have the ability to speak afterwards. I've seen it with my own eyes.
Interesting.
That's why I'm such an advocate.
How many other operations are there like yours in the Ocean State, do you know?
There are similar organizations to ours. There are other nonprofits out there that specialize in treating patients. But as far as I know, we're the only one that's gone through the process to be a licensed nonprofit and organization through the state. And we've basically gone through the process of having all of our business licenses and retail licenses in order so that we can treat patients on a decent level.
So obviously being licensed for a business is straightforward. Most people understand that. But being licensed to handle marijuana, you're licensed by the state.
We're licensed by the state. We're not licensed to handle marijuana. We're licensed to treat patients, and we basically put patients and caregivers in connection with each other. Right now, if you become a patient in the state, you get a card which allows you to go to the compassion centers, any compassion center that you like, but at the same time, you're allowed to have a caregiver or a specific grower for you, and that's where we come in.
Okay.
So the patients register with us. We have up to 5 patients at a time, and we make it possible for them to have a spot where they can come and get a legitimate caregiver, and then the caregiver and the patient chooses to meet where they'd like to. They have a spot at our office if they can, but it keeps them from having to meet in dark alleys or in parking lots or having people come to your house when you don't know who they are or have to go to their house. It's a dangerous situation. So
I would assume, you see, you've probably opened a lot of eyes already about the true medicinal uses and potential value of these products, but I bet you have to overcome a certain, comic approach to it, or the jokes that are made about, I'm going to get high and
there's still quite a stigma involved in it, and a lot of people don't know where to go. Sometimes they're embarrassed to talk to their primary care physician. So that's where we come in. We offer a lot of information and education. We have growing classes, cooking classes, so we teach people how to use the product themselves to the best of their ability.
Just as a rough ballpark, how many of your patients do you think come in with some prior experience with recreational marijuana, or how many of them just come in because they heard that with their condition they might be able to get some help?
That's a great question. I'd say probably 70 or 75% of our patients have prior use with cannabis, whether it be recreationally or medicinally. We like to say that you don't really recreationally use marijuana. Believe it or not, you're actually treating yourself with medication, whether it's for stress relief, muscle relaxation, whatever you use it for.
That's pretty interesting.
Once we tell people that, they look at it in a different point of view.
Well, again, there is an attitude towards it that's in the process of changing throughout our culture. Pat, right now we're going to leave it at that. This is the end of our first segment, ladies and gentlemen, but stay tuned because Pat Rimoshytus will be back for 3 more segments of this very interesting interview. We do, however, have to take a break right now because I have reason to believe that someone is about to ask the question, "Are you kidding me?"